Okay, ours was diabetic peripheral neuropathy, and did anybody bring it up? Nope. What? Oh. Sorry, thank you. Okay, and ours says you're discharging a diabetic patient who has been having numbness on the bottom of his left foot. What do you do?
That was cool.
Okay, what is diabetic neuropathy? It is nerve damage to the legs, feet, arms, or hands caused from prolonged exposure to high blood glucose, and it typically starts with the legs and feet first. And works its way up. That's peripheral neuropathy. I didn't put that up at the top, but there's different types. This is peripheral neuropathy with the arms, hands, legs. The symptoms are numbness, tingling or pain in the toes, feet, legs, hands, arms, and fingers, wasting the muscles of the feet or hands, dizziness or faintness due to drop in blood pressure after standing or sitting. You can also get ulcers. You can lose your toes, even legs, if it gets that bad.
People get ulcers if they have diabetic peripheral neuropathy.
Because they can't feel it.
And what happens when you can't feel it?
You don't know if it's hurting or if it's like infected.
You don't sense that you've injured yourself, or you don't sense that you have an infection. Very good.
Those are fun.
I want to make one.
So there's not very many treatments for this. Some of the main things you can do is control your blood sugar, manage your symptoms, and if it comes to it, amputation might have to be done to prevent infection spread.
So before your patient is discharged, you have to do some teaching to tell them how to take care of their neuropathy. You want to tell them that they should check their feet every day and make sure there's no blisters or cuts. That way it doesn't go unnoticed and they'll be able to catch it early. You want to keep your feet clean and dry so that you don't have any erosion of the skin. You want to make sure your toenails are trimmed carefully, and if you're unable to do it, have somebody else, like a podiatrist, do it for you to prevent you from cutting your toe and getting an infection. Always wear clean and dry shoes. Never go without shoes because you won't be able to feel if you step on something that could hurt your foot. And controlling your blood sugar levels is important because it's the whole reason why you're getting the nerve damage to your feet. And you also want to schedule an appointment with a podiatrist 1 to 2 times a year just to make sure everything's going well and make sure your symptoms aren't progressing.
Okay, so when you assess for, like when you go in and you're assessing your patient for it, you're going to compare both feet. You're going to check for the odor, cleanliness, or the skin integrity, palpate for edema, check for cracks in the skin or signs of infection between the toes. Obviously lack of numbness, and that can be done with the tuning fork. You hit it and then put it to the patient's foot so they can, if they can feel the vibrations or not.
Where do you put it on the patient's foot? Any of you?
On top?
Specifically, where's a good place? Put the tuning fork. On what? On a joint, like on the